Ear discharge. Ear discharge is not equal to otitis media, though most commonly it is equal to otitis media. Ear, external ear, middle ear, internal ear. Otitis externa, otitis media. Otitis externa, infection. It is bacterial skin infection, rarely a fungal infection. Vaccine ear. Rarely in infancy or older children, foreign body in the ear. Unnoticed foreign body coming as otitis externa. But in newborn, vernix caseosa is on the skin in fetal life. At the time of birth, skin is covered with vernix caseosa. It is also extended in the skin of the ear, external ear. So sometimes within 10-15 days or 1 month or so, rarely vernix caseosa comes out and people think that there is pus from the ear. So in 10-15 days old child, we have to see whether really there is pus from the ear or not. We need not go according to mother's complaint or family's complaint. Otherwise, there will be over-drugging, risk of over-drugging, unnecessary antibiotics, unnecessary antihistaminics, unnecessary analgesics, unnecessary ear drops, medications. When unnecessary medications have no role in medicine. So that's why we have to be aware of this condition. In infancy, eustachian tube joining oropharynx to middle ear is broad and straight. As child grows up, toddler to preschool school age, eustachian tube becomes long, oblique and small. Bottle feeding in horizontal or supine position is one of the commonest cause of otitis media in infancy, because eustachian tube is broad, eustachian tube is straight. Milk from the bottle by gravity can go to middle ear. No child should be bottle fed. Bottle is not good. But even if child is bottle fed, child has to be in propped up position. At least 30 to 45 degrees propped up position, so that middle ear is up and oropharynx is down. So by gravity, milk does not go down and cause otitis media. Next common cause of otitis media is common cold, coryza, viral infections. These are mucous membrane infections. There is mucosal edema. It can block the eustachian tube. The edema can block the eustachian tube. And wherever there is mucous membrane in the body, its job is to secrete something. So these secretions are pent up in middle ear. This is serous otitis media. It gets infected, secondary infection, bacterial infection, it becomes purulent otitis media. Pus anywhere has to come out. Either by incision drainage or it will find its own way to come out. Commonest way is rupture of tympanic membrane. Pus in the ear means tympanic membrane is ruptured. To give vent for the accumulated pus. That's a defense mechanism of the body. Generally it heals, otitis media heals, body's immunity manages the infection, controls the infection, eardrum also heals and problem is solved. So that is acute suppurative otitis media. Acute suppurative otitis media. Chronic suppurative recurrent otitis media can occur. In that case, it can affect the middle ear permanently, causing deafness. So recurrent otitis media is risk of deafness. Chronic otitis media is risk of deafness. The three small bones attached to tympanic membrane, ossicles, can get infected, sclerosed, and cause permanent hearing disorder, deafness. Acute otitis media will have fever, earache, tachycardia, excessive crying, sometimes vomiting, raised WBC count, raised polymorph count, indicating suppurative infection and appropriate antibiotics in appropriate dose for appropriate duration. inappropriate antibiotic in inappropriate dose for inappropriate duration is problem of the day. So while becoming pediatrician, we have to know what is appropriate for everything and what is inappropriate. That also we should know. So you don't do mistakes. You detect mistakes done by others and correct them without telling that somebody has done a mistake. You can correct them. You are here to correct the mistakes and in the interest of the child. Selection of antibiotic dose we need not consider at this moment because that we all know. Because that itself is a 1 hour duration topic. But as we have stethoscope, doctors, a pediatrician must have otoscope in his pocket. It's simple. It's inexpensive, 2,000 rupees or something. Otoscope and fundoscope in a single unit is available. You can remove the fundoscope, you can attach the otoscope, you can see the tympanic membrane. By putting torch in external ear does not show tympanic membrane. It's a show, which doesn't show anything. So purchasing and having own otoscope is a must for pediatrician. You can't work as a pediatrician without otoscope and fundoscope also, for that matter. Head injury, we see pupil, we must see fundus. Convulsion, we must see fundus. If you are trained and you have practiced, one can see fundus through undilated pupil also. Ophthalmologist for purposeful examination need dilatation to look at the fundus. But a pediatrician in busy practice also can look at fundus if he tries and if he is trained. Yes, I have seen many times. Similarly, tympanic membrane bulging, blanched, white, tense, red, inflamed, with rupture, without rupture, can be seen. You can record the diagnosis. You can record your findings. We have to learn the skill of looking at the tympanic membrane. So you have to pull the earlobe down and out and see. Down and out and then see. So that the tympanic membrane is visible. Whether whatever is coming out is pus or not. Hydrogen peroxide drops. If there is any vegetative matter in the ear, some wax or some skin thing. Small bubbles come out when you put hydrogen peroxide in ear. If there is pus, it will froth. बस व्हाइट येलो फ्रॉद आएगा. व्हाइट येलो फ्रॉद आया इसका मतलब पस है अंदर, इसका मतलब ओटाइटिस है. Ear drops do not cure otitis media. Ear drops are only for otitis externa. Antibiotic ear drops, anti-inflammatory ear drops, anesthetic ear drops, कॉम्बिनेशन ईयर ड्रॉप्स, क्या है मालूम नहीं, सब का मिक्सचर दे दो, जो कुछ होगा अच्छा होगा. एंटीबायोटिक, एंटी फंगल, एनेस्थेटिक, सब का मिक्सचर डाल दो, जो होगा सो अच्छा होगा. ऐसा नहीं है मेडिसिन. अगर फंगल इन्फेक्शन है तो फंगल ईयर ड्रॉप्स देना है. तो कुछ डायग्नोस्टिक, कुछ तो एफर्ट चाहिए. वो नहीं किया तो फिर ऐसे कॉम्बिनेशन आते हैं. ड्राई ईयर heals, wet ear does not heal. Putting eardrops in a child with otitis media makes ear wet. The treatment is make a cotton wick, फुलवात निरांजन में लगाते हैं वो, या पंटी में लगाते हो दिवाली में, कॉटन विक. मेक अ कॉटन विक, पुट इट इनसाइड, it will absorb the water, make the ear dry. Mother should be taught to do this 3 times a day so that the ear remains dry, then it heals. Wet ear does not heal, dry ear heals. Main treatment is even absorbent paper, टिपकागत, absorbent paper और टिश्यू पेपर विक डालना है. तो टिश्यू पेपर वेट हो जाएगा, बाहर निकल के देखना, वेट हो गया फेंक देना, दूसरा डालना, वेट हो गया दूसरा डालना, ड्राई हो गया, कान ड्राई हो गया. दिन में 3 टाइम माँ ने कान ड्राई करना है. ये क्रॉनिक और एक्यूट भी ओटाइटिस मीडिया की ट्रीटमेंट है. तो ओटाइटिस मीडिया पे क्वेश्चन भी आता है, थ्योरी में भी आता है, प्रैक्टिकल में भी कुछ तो भी हो सकता है. ईयर ड्रॉप्स ड्रग करके दे सकते हैं. ये प्रैक्टिकल अंडरस्टैंडिंग इज ऑल्सो इम्पॉर्टेंट along with sound theoretical knowledge of anatomy, physiology, bacteriology, pharmacology, सब का ज्ञान चाहिए और फिर मैनेजमेंट कर सकते हैं. थैंक यू.